So I think that we just accomplished all these talks of our presenter, and I look at the time, and we have plenty of time for question and discussion. So we will have now about 20 minutes for question and discussion of our session. We are very happy that you respect the time, you kept short and giving more time for discussion. I would just raise your hand, identify yourselves, your name, your institution, and ask direct question. And we take a few questions, and we can make several rounds depending on the time availability. So, yeah, please.
Great, thank you all. My questions are for, I guess, Joanna and perhaps Hugo as well, on seasonality of the aflatoxin exposure, because I think the two studies, your work, Joanna, in Nepal, if I understood correctly, you have a higher exposure in the post-harvest period, whereas in rural Ethiopia, there were a panel of aflatoxin. Some there was no seasonality, and others had lower exposure in the post-harvest. And I wonder if either of you had some ideas of why this is happening. Oh, sorry, I'm Nilupa Ganaratne from Purdue University.
Yeah, I'm Vasanthi from the NI in Hyderabad. I have questions to both the speakers on aflatoxin biomarkers. To Dr. Groot, since maize is always considered as a high-risk commodity to aflatoxin contamination and has been extensively documented as the main source of exposure, particularly in the African population, why would you think that there was the exposures were not detectable from maize consumption? Is it that the effect of processing that's making a difference, particularly in Ethiopia, whether there's a difference? And to Johanna, you have not mentioned what is the main source of dietary exposure. What is the staple cereal in Nepal? And then what was the weaning status of the children? Were they completely breastfed? Because breast milk could have also been a source of exposure, and whether you have measured the biomarkers in breast milk. And what was the consistency in the level of biomarkers within a season? Where they're widely varying given the high heterogeneity of aflatoxin contamination? Were they consistent within a given season? Like in winter, you said it is very high, but even with their day-to-day variations, even within the season, because today they may be consuming from a contaminated lot, but the next day they may be consuming from a less contaminated lot. Thank you.
Okay, thank you very much. May you give the microphone to Jeff over there? I believe that would be a question on aflatoxin. We continue the flow of aflatoxin questions, please.
How do you know?
Yeah, I suspect, it's high.
Good guess. So yeah, first question for Hugo. On your conclusion in the abstract book, I'm not sure you said it here, that way it's hard to see you because there you are. That we need longitudinal studies to do the causal inference. Obviously, if it's observational, then it's still not going to allow you to do causal inference. So two comments. The first one is that we have one experimental study that showed no impact of reducing aflatoxin exposure on linear growth. More importantly, I think we should collectively stop kind of chasing the aflatoxin linear growth relationship. I'm not sure it's terribly useful to understand it. Aflatoxin is a carcinogen. It limits countries' capacity to export products. We need it gone anyway. And I think when it comes to nutrition, I would feel that the next contribution would be for people to look at what it does with the gut. There is some hypotheses that it leads to enteropathy, that it causes inflammation. I mean, those are terrible outcomes for children, and I think we need to understand that better. And then a quick question for Johanna. Yeah, I was also wondering why you found the highest level in the dry season, given that you need humidity for this to grow. So thank you.
Okay, thank you very much. I may take one more question if it's about aflatoxin. So you can just continue the discussion. No, Jeff, so I take you up that maybe you come to next up, please.
Okay, hi, I'm Anthony Wendt, Cornell University, and I work on the food system contamination side of the aflatoxin contamination exposure equation. And so my question is to both of you aflatoxin scholars over there. I observe in my work that it's very difficult to make an explicit relationship between, food system contamination and how much of that aflatoxin is actually filtering into people's diets, and then furthermore, what level of human exposure is sufficient to warrant a public health intervention or, concern over this amount, because these interventions are things that take time and effort and resources. And so I wonder if you, from the biomarker side, can give your 2 cents on, whether the levels that you are seeing are convincing enough from like a public health perspective to warrant the large amount of work that it would take to roll out a large-scale public health intervention.
Okay, thank you very much. So actually we have 4 questions, and all of these 4 are about aflatoxins. Now, could you please be patient a bit, because I come back to you and Jeff. I know that you are in the priority list. Okay, 4 questions for you, Hugo and Johanna. And so you can just share the microphone in an equitable way to respond to this answer. Okay.
Yeah, so all great questions. I'm not sure I have the answers to a lot of them, because we saw that pretty consistently. Post-harvest is where the higher mean levels were, regardless of the age group. And what we suspect is just a higher abundance of food available. Specifically, for example, peanuts and corn are harvested at that time. And even though in Nepal, this region in Nepal, corn's not really consumed by many people, we did find in the women, when we analyzed their dietary data, those who were consuming corn had significantly higher levels of aflatoxin. And so we're just thinking maybe post-harvest, they got this fresh amount of corn and peanuts available. Their diet might just have more of it. And that's something that we are gonna look at with all the dietary data across the time points for the children too, because we have that data, we just haven't dug into it quite yet. And you're wondering, Jeff, you mentioned, so that's not the humid time, right? But in terms of temporality, so it's after that hot, humid monsoon season in which the mold is more likely to grow, you'd expect that that's when that contamination would be higher after that, and that's, I think, what we're seeing. And then, Vasanti, you asked a few questions. So I mentioned already, corn and peanuts maybe not as big as in African countries where this research predominantly takes place, but still something that we're seeing is correlated with the aflatoxin levels with our maternal dietary data. And then we actually have a partnership with a post-harvest loss for the future, and they're measuring levels in food from our households from a subset, and so that's some upcoming research that we're looking forward to, because then we'll be able to see where what foods may be contaminated. And so we're looking at corn, peanuts, chilies, rice, and complementary foods. So, and then we did analyze breast milk for aflatoxin M1. So it's something I'm not looking at personally, but it's something that I can put you in touch with our collaborator in Nepal who's looking at that, and he'd be happy to answer your questions there. We have about 1,400 samples from the moms, and most kids were breastfed exclusively for a pretty long period of the first 6 months. So that's nice that we'll be able to also look at our aflatoxin levels in blood and their correlation to the breast milk levels. And we are not able to say anything about day-to-day variation with the type of biomarker that we use. This biomarker measures exposure over the past 60 to 90 days because the half-life of aflatoxin is B1 is that. So that's what we're able to see with our data. And I think I answered. Oh, your really hard one. I don't know the answer to your question. What the levels we're seeing, what really matters, does this warrant a public health intervention? I think Jeff brought up a good point. We know it's a carcinogenic. Are we going the wrong way with looking at it with stunting, or is there something we need to reconsider? I don't quite know. I know that it concerns me that this many kids are exposed regardless of the level because it is a carcinogenic. So it's not something that we're wasting time on, that's for sure. I just don't know if it warrants a public health intervention, and because it's such a complex public health intervention, because it can happen across the food chain, that might be a little difficult to figure out too once we get there, but I don't know.
I think that answers all the questions. Okay, from our side, so on the post-harvest and the pre-harvest, we only had 2 points. We didn't have the monthly like you had. What the problem is with you would expect when the maize is consumed from the store, the longer it has been stored, the higher the level of aflatoxin. But in maize, in many places, the people run out and then they buy the maize. So then, and we have not made that distinction. So that's still on our list of things to do. On why maize does not have an effect, most likely it's because we didn't have enough sample size and we didn't have enough variation. Because on the processing in Ethiopia, it's usually taken to the posho mill and the whole maize is used in the consumption. So that would not have an effect. Then on the longitudinal and causal, yes, you are right, that would not be a randomized control study. I think what we meant was to have to see the relationship more clearly, we would have to do a better study. Now you're asking, is that important? Well, we thought we had the data, let's check it. We didn't do the study to do that, so. And then, yeah, what is the highest level? I don't think we have that information right now. You would have to have more data on from which level does cancer become a public health problem. We don't have that data.
Okay, I think that is the first round has been covered. I hope that you are happy with the response. Now let's take a second round of question, and of course, Jeff, you are the first.
You're right, Hung. I'm on the malaria topic. So I'd have two questions for our speakers on malaria. First, for Adoronke. My impression is probably in the region you studied that agriculture would be a seasonally variable activity in terms of labor and work, and possibly malaria as well. And I'm wondering if you could extrapolate from your very interesting studies about the effect of malaria on agricultural productivity to what you feel might happen over the seasonal variation in both agricultural activity and malaria. Were you sampling the high point or the low point of possible interactions there? My second question is for Julien. Julien, I wasn't quite clear. You were doing a transect from rural to urban, but was that transect through rice growing all the way from rural to urban? And so you were looking at urban and rural rice production and comparing it. And do you have a hypothesis as to why you were seeing more outside biting in urban areas?
Okay, so can you go to the lady at the end of the room? Thank you.
Thank you. This is Ramya from Purdue University. This question is for Tarek. I absolutely loved using competition and emotional drivers as a way to uptake behavior. So I have a question and a comment. First, the question is, have you guys considered competition between children? Because nothing gets the parents going than having competition between children for an uptake. My second comment is you said we focus on young women because we want to improve stuff for the 1,000 days as of children. It's a comment that we should focus on women for women themselves and their well-being. So it would be nice to kind of shift that, have the paradigm shift to focus on women's well-being as well. Thank you.
Okay, thank you. Any other question? I saw a few hands. Please.
My question is, I'm Satish from CRS. My question is very much similar to what he asked with regards to malaria and its effect on agricultural production. So I was wondering, agricultural productivity largely depends upon the landholding size and type of land also. So how did these factors taken care of in your study?
Okay, thank you. One more question, maybe, for this round. Can you go, please, here, please?
Thank you, everyone. So Jeff already asked my seasonality malaria question. I'll just ask the next one that I had to Dr. Mohammed. I was wondering how, so congratulations on a novel approach, because incorporating emotion into public health interventions is not an easy task. I was wondering how you make sure that the women maintain positive interactions and positive relationships and avoid any emotions of shame kind of in the process. As a way to continue to retain that information and continue attendance. Thank you.
Okay, maybe for this round I take one more question, if you have any. Okay, so you have a question? Do you have a question? No? Okay. So now for question, but don't hesitate to continue asking question on aflatoxin. You don't have to ask only on malaria and then water sanitation. Okay, so now is Julian.
Okay, thank you very much for that question. I said malaria is endemic in Nigeria and it occurs across seasons. So not only maybe during the dry season or during the wet season. And that was why, in order for us to be able to relate it with crop productivity, we looked at malaria during the farming period. That cut across both the dry season and the rainy season, because the rainy season terminates in the month of October and dry season becomes in the month of November and December during the harvesting period. So we were able to look at the effect of malaria on, on crop productivity during all the seasons. Yeah. And then the other question is also, you're looking at malaria vis-a-vis labor, right? That is what we consider most, because if these household members have malaria, definitely they will not be able to attend to their farm activities, and if they are not able to attend to their farm activities, it affects their productivity in so many ways. And this is the aspect we looked at, especially with labor. And that's why we tested for malaria to ascertain that it was not any other factor that causes them not to be able to go to farm, but because of malaria. I think I've answered your question, right? Thank you.
Thank you, Jeff, for your question. We work in rural and suburban area in our study. For urban area, I can say that we will have also high number of mosquitoes, because the production of mosquitoes depend on the irrigated rice fields. But the urbanization just changes the behavior of mosquitoes. It only will irrigate rice fields which produce the vectors, but the urbanization changes the behavior. I don't know if you understand. I said that regarding the abundance of vectors, it will be the same in urban, suburban, and rural area. But about the behavior of mosquitoes, it's likely that the behavior of mosquitoes in urban area could be different from the behavior of a mosquito in rural area. So we will have the same risk, I think.
Thank you so much for your questions. The question about competition for children, we actually did not have any competition, but it sounds like it's a very good idea. And I totally agree with your comment. I mean, in this case, specifically, our target was undernutrition for children. So that's why I mentioned it, but I totally agree with your comment. Thank you. And please ask me again if I have not addressed all of your questions. But to start with, in general, we didn't feel that through any of our activities there was any concern for shame, because there was a combination of group events and individual household visits. So often our food hygiene promoters would actually work with the women. For example, like they will be asked, can you show me how do you serve the food? And suppose if she reheats it, then there will be a thermometer used to show her, give feedback that, okay, this was properly reheated or not. So they actually worked with them. So the competitions were only announced at the end. So as you have seen that almost 40% own the clean kitchen competition. So it was not that only one or two own it and makes most people didn't own it. So there was, I think, a source of fun and achievement for those who own, and I didn't believe that there was any shame, but the other point was that these were women's groups, and there were two types of women that were supporting the intervention activities. One was a village model farmer who would be within from the community, and there would be another women if the village model farmer was not, sometimes like the village would be very long, so houses would be spread, so there would be like additional group leader. So they would work with them, and we continuously monitored the group cohesiveness, and whenever there was a problem, often we had to break the groups up to, as I mentioned also, sometimes for religion, there were like, people didn't want it to go to the compounds with Muslim households. And so what we had to do is we had to break the groups to make it into smaller groups. So we were mindful of that. Thank you.
Okay, thank you very much. I mean, I was about to say that for the topics, this year's UN selected 7 June as the International Day of Food Safety. And I think that I saw in many countries, they talked a lot about hand washing and how to keep the kitchen and all these things hygienic at the household level. So it's very relevant as well. So Julian, may I ask you a question? It looked like that you said that the number bites by mosquito was higher in women than men. Do you have some data on that, or I misunderstood you? Do you have more bites for women?
No, I said that the biting rate is higher during the transplanting stage of rice cultivation, not in human and man.
Not human and man.
No.
Okay. Yeah, I was thinking about the genders, about the bite. Okay. Thank you very much for all this discussion and question. Do you have any other questions for our speakers? Okay, it looked like that you are very satisfied with this response and presentation. So, ladies and gentlemen, I think that we had a good session about health and food safety, and as said from the beginning, we are very happy to have this session at this Academy Week, because we didn't really have many kind of contribution in this line of health and food safety usually in that academy. So we cover various topics on health related to mosquitoes, on aflatoxins, but also on water sanitation and hygiene in different countries. So I see here in Nigeria, Ethiopia, Nepal, Bangladesh. I didn't see, and Cote d'Ivoire, I didn't see any contribution from Southeast Asia, where I come from. So next time I think that we will have some from Southeast Asia. And I think that, we put together a very nice session highlighting different findings from different countries. So this I like very much as a discussion on aflatoxins. I think that, not only in this room, but at global level, aflatoxin issue has been discussed a lot about the impact, and if really it's a big issue to go on aflatoxin in different countries. So we did some aflatoxin study in Southeast Asia, and fortunately from Vietnam level, for example, the concentration of aflatoxin in maize, both from harvest and post-harvest, is very low, and we are very happy. Not because we don't eat a lot of maize, but it's main source animal feed for Vietnam. So it looks like that we have more problems in Africa, and we should continue carry out this kind of study. With that, I would like to ask you to join me to thank the excellent contribution of our speakers at this session. And of course, we would like to thank you for the active participation and the attention. Thank you very much. And